Hi, this is Dr. Jason Dulac coming to you from my office, Dulac Dental in Springfield, Virginia. Sometimes people ask me, why'd you get in this? How do you get into it? And I just wanted to go over a little bit my bio today and how I came to where I am today. So I currently own and operate Dulac Dental in Springfield, Virginia. I have over 2,000 hours of CE. I have postgraduate education. I have my own office. I have a wife and kids. So how did I go from, my teens to here? When I was in college, I thought I might want to be a doctor. Science always appealed to me, medicine, the idea of helping people, those were all very attractive. I shadowed some physicians. They weren't really happy with their lives and the state of medicine. And my dentist, Dr. Lambert, had said to me when I came in for my light cleaning checkup, he's like, well, when you figure out you don't want to be a doctor, you can come shadow me. And so later that summer, I called him up. I said, "Hey, was that legit? Like, can I come shadow?" He's like, "Yeah, come on in." And I watched him do a root canal, a bunch of cool stuff. All the prereqs were the same. It was very appealing. I took the dental admissions test, got into dental school at the University of Michigan. And during one of the interviews at one of my kind of backup schools, one of the professors had said to me, like, how do you want to pay for dental school? And I said, I don't know. I figured just loans or whatever. He's like, well, there's another way. I was in the Navy. My son's in the Navy. If you want to go in the Navy, I know this great recruiter. I'll set you up with her. I said, yeah, that'd be great. Donna Bradley was her name. She was a nurse. She helped me through the process and I applied. And after I got into dental school, the Navy accepted me into their scholarship program. And I went to Officer Basic before going into 4 years of dental school at the University of Michigan. And then in Officer Basic, I was a O1 or an ensign in the Navy. And then after graduation, I was commissioned active duty lieutenant. So that was back in 2009. And then I did a year of postgraduate training, AGD, Advanced Education in General Dentistry, at Great Lakes Naval Base, which is north of Chicago, now called the James A. Lovell Federal Healthcare Clinic. And that was a good experience. Got to do a lot of advanced education in dentistry in a lot of fields, and then did another 4 years in the Navy after that. 2 years in Okinawa, Japan, with the Marines, on and off a couple different ships. I was on an LHD-2, the Essex, and LPD-9, the Denver. So any of you old Navy guys, the Denver's, well, it was finally decommissioned, the second oldest ship in the fleet after the Constitution. So I've been on a ship that most of you have been on, or was in service as well when you were in. And then I did 2 years in San Diego, which was awesome. And I met my wife there. And after getting out, decided San Diego was a lot of fun when, I was on a naval base looking at the ocean every day. But once I was inland and an associate and driving around the desert, it wasn't as appealing anymore. So my wife and I moved out to the DC area for her job, Northern Virginia. She was at the Pentagon at the time, and she's home with the kids now, but that's what brought us to this area. And I was associate here for a couple of years and got introduced to Dr. Markoff, Dr. Bruce Markoff, acquired his office in 2017 and I've owned that office now for almost a decade and really enjoy it there, really enjoy my team, really enjoy the office, enjoy dentistry. And over that course of time, I got my master's of the Academy of General Dentistry. So that's an award that only 1 or 2% of dentists have, and it recognizes general dentists for advanced education in the field. So I have probably pushing 2,000 hours of CE at this point. So that's why I love doing all the things that I do. So I do a lot of things that dentists don't do. I do orthodontics, periodontics, gum surgery, root canals, braces, clear aligners, Invisalign, oral surgery, implants, airway management, sleep appliances. There's very little I don't do. And that's because I love it and I get bored easily. So every couple of years, I add something new to the belt. And it probably drives my wife Kate crazy because I'm always doing CE, but I love dentistry. I love providing comprehensive care to our patients. The more you learn, the more you can diagnose and see in your patient base. So if you're looking for somebody who was former military as a provider, if you want somebody who can provide, a wide degree of services that you normally would be referred to a specialist for, if you want somebody who can put you to sleep for your procedures, I have an anesthesiologist that comes into the office. If you want somebody that can do same day crowns, I have a same day crown machine. Only 15% of dentists have that. There's a lot of things that I can do for you if you are looking for an office that's kind of fun. The team likes to have fun. The patients like to have fun, with a doctor that knows what he's doing and is very compassionate about the care that he gives to his patients. Please give us a call, 703-451-4500.